Channel 5 Network. This is Open Line.
Hello, everyone. Welcome to Open Line. Very important topic tonight. We're talking about health care in Tennessee. The reality is rural hospitals are closing. There are many people who do not have health insurance, and that's just what many people are facing in Tennessee today. And we want to try and talk about that today. What can we do about it? Where do we go from here? Happy to have with us Chris Coleman, who is with the Tennessee Justice Center, staff attorney. Thank you for being here.
Happy to do it.
So when we say Tennessee Justice Center, how does that play into this discussion about affordable health care?
Well, Tennessee Justice Center, TJC, we're a nonprofit law firm. We're founded in 1996 to sort of fill a gap after Congress put new restrictions on any legal aid program that received any federal funding. There were things they couldn't do, notably class action lawsuits or any lobbying to attempt to change laws or to, say, expand Medicaid. So we broke off from them and were founded by Tennessee bar leaders to fill this gap. And we focus on issues in which basic necessities of life are at stake. So that traditionally has meant access to health care.
Right.
Making sure people have affordable health care, dealt a lot with the 10 Care program. And we also deal with SNAP, or what formerly known as food stamps, to make sure people have access to adequate nutrition.
So are you filing lawsuits on behalf of people that, I guess, are being denied access in some way or that kind of thing?
That's something that we do. Most recently, when the Affordable Care Act was first implemented, 10 Care didn't have a computer system for people to apply, and we're sending everybody through the federal government's website, the federal marketplace, healthcare.gov. And that caused the enormous delays, so people would apply and wait 3 or 4 months before they would know if they were eligible or not. So that's the most recent lawsuit we filed, the class action lawsuit.
What do you see as the state of healthcare right now in Tennessee? I mean, I kind of said some things off the top, but what are you seeing based on what's coming through your office and just where things are right now as far as healthcare?
Well, anytime you talk about healthcare in Tennessee, there is an 800-pound elephant in the room, and that's Tennessee's stubborn refusal to expand Medicaid, to accept federal funding to do this. This would cover about 280,000 people in Tennessee. People who still show up at emergency rooms, still need health care. They're going broke, while at the same time the hundreds of millions of dollars in federal funding that would be coming into Tennessee to cover these people is not coming. So this is causing our rural hospitals to close. We're a national leader in rural hospital closures. We're #1 per capita. And this is directly, even the Government Accountability Office, the U.S. Government Accountability Office says this is because of Tennessee's failure to expand Medicaid.
Governor Haslam wanted to expand Medicaid. It didn't happen. It really wasn't even close in the legislature. We just had a governor's race in which one candidate was for expanding Medicaid, the other was not, and the one that was not won by a large margin, Bill Lee. So when you fill out those numbers, if those kind of people voted, it seems like it would make a big difference. Do you think the message is getting through? Why is you said the stubborn refusal? What's going on, do you think?
I mean, this remains absolutely political. It has nothing to do with policy. There are no good arguments against Medicaid expansion. This is a stubborn refusal because it's associated with President Obama. People in Tennessee generally don't like President Obama, and especially the people in our legislature, because there is a bill now. It's not just the governor's decision. It has to go through both houses of the General Assembly, and many of the people who are elected are very opposed to Obamacare in any form, even if all of the policy arguments in its favor are rock solid and convincing. They will never vote for it, and they're hurting the people of Tennessee very badly because of it.
And I guess put some faces on it. We've heard that, and it still hasn't moved the needle. Give us one or two examples that kind of stick out to you of how it is.
I mean, there are so many stories, it's hard to even think of one. The people who are affected by this, right now, the way TennCare works, TennCare only covers people in certain categories. So if you're a child, a pregnant woman, a person with disabilities, or a parent or caretaker relative of a young child, you're eligible. But if you're not in one of those categories, if you're a single childless adult, then you're not eligible for TennCare no matter what your income is. What the Medicaid expansion would do was provide coverage to low income, below 133% of the federal poverty level, low income adults. Many of these people work, they just don't, their jobs don't offer insurance, they can't afford it. They're not eligible for the Affordable Care Act, the subsidies that help you buy, help you afford the premiums for private insurance. So they're stuck with nothing. Everybody else gets some sort of subsidy. Everybody out there with private employer-sponsored insurance, people don't know this, but that's a huge subsidy that you get because that is not taxed. You don't, your employer, the federal government doesn't tax your health care benefits. It taxes your salary, but not your health benefits. It's the third largest health program in the country. Everybody, if you have employer-sponsored insurance, if you have ACA coverage, if you have Medicare, everybody else gets help except for this group of people. And it's a real tragedy that we're not taking advantage of this money that the federal government is offering us to cover these people. And that the Tennessee Hospital Association has said the very small share, the 10% of this cost, of the total cost that would fall on the state, the Tennessee Hospital Association, recognizing where their interests lie, which is they would make a lot of money and would stop the bleeding that's happening right now. They said, we'll cover that other 10%. And still, legislators, despite the fact that it would cost the state nothing to cover 280,000 people, it would keep our hospitals open, it would provide health care to people who really need it, the legislators still won't do it.
And so where do we go from here, do you think?
I mean, there's nothing but to keep pushing. I mean, we can't give up on this issue, and I think ultimately this again stubborn refusal to expand Medicaid is leading to pushes for Medicare for all. So all the people, conservatives should realize, oh, we have a fix now that could cover more people. If we don't like Medicare for all, maybe this would be a way to stop the political momentum for that. But if we're not going to cover that, if we're not even going to expand Medicaid, then there's going to be an increasing fervor for people to just do Medicare for all.
It seems like I've heard that some people have said they're opposed to it because it gives us a lot of money in the beginning and then it slowly withdraws the money. Is that right?
That was right if we had done it in 2014 when it was first available. There were stair steps down. The federal government covered 100% for the first 3 years, so that would have been through 2017. And then it stair steps down to ultimately 90%. But again, that other 10% that the federal government doesn't cover, the Tennessee Hospital Association has said, we will cover this. Now, some legislators have said, well, we just don't trust them to do this, and we're going to be left with the bill. Nothing would stop them from writing into the legislation that if the Tennessee hospitals ever stop paying for it, then it would end on its own accord. Mm-hmm. But they're not willing to consider that because ultimately that's not the issue. It's not a policy issue or where the money is going to come from. It's ultimately political. They don't want to expand health care because they don't think people deserve it.
And so what do you say to them? The ramifications are severe. I mean, we've heard that they were going to be severe, but now we're really seeing it, right? I mean, you're seeing it with hospitals closing and you're seeing it with this large number of people that are not insured. I guess, how is it impacting this state in real and tangible ways?
Well, I mean, we've talked about the hospital closures, and that's the fact that a state like Tennessee, which is the center of the for-profit healthcare industry, Nashville is where HCA comes from, and CHS, and all of these for-profit hospital companies come from. The fact that we can't keep our rural hospitals open means that If you look at a city in West Tennessee, Brownsville, their hospital closed. Now the city owns one ambulance, and they take people to Memphis. That's because their hospital closed. They don't have anywhere else to go, so they just have one ambulance, and you better hope your heart attack doesn't happen when somebody's having a baby or somebody else is having a heart attack, because that ambulance is the only way you're going to get health care.
And how far is the drive to Memphis?
From Brownsville, it's an hour, and they also don't take you back. So they get you there and they get you to the hospital, but you have to work your own way back.
And how is this, how does this keep going? I mean, it seems like at some point people would say, wait a minute, that's ridiculous. But is it just getting more and more out of control, in your opinion? I hadn't heard that. Is that a new thing? And is that just going to continue happening in other communities? Or is that one community just out of luck?
It's not just that one community. It's rural Tennessee writ large. It's all of our rural communities are facing a crisis. We've had, depending on how you count it, some hospitals have closed parts and opened just freestanding clinics or emergency rooms or something like that. But we've had about 11 hospitals closed, leaving these counties with no hospital at all. The closest hospital sometimes being 2 counties away. People will die. People are dying because of this. And our legislators don't seem to care. They could stop it tomorrow, but they actually don't care about rural Tennessee, despite the fact that they talk a big game about, wearing plaid shirts and riding on tractors.
But lawmakers are sent by people from rural Tennessee. It is these rural lawmakers, many of them, who are opposed to Obamacare and opposed to expanding Obamacare. And so why isn't it getting to those lawmakers? If that's the reality on the ground, it seems like they would say, well, let's just call it something else and let's do something here. But it's not getting through.
I mean, I don't understand why tomorrow they don't say, hey, we're going to call this Trump Care and we're going to expand it. It'll be Bill Lee's Trump Care plan. Everything will be good. It won't be associated with Obama at all. But they don't want to do it because ultimately it's an ideological and political belief that if you're poor and don't have access to health care, then it's your own damn fault. Which that's what our Tennessee lawmakers believe, as shown by their refusal. Vanderbilt has done multiple polls on this. It's overwhelmingly popular. People in Tennessee want this. But in a state that's overwhelmingly Republican, which is fine, Governor Haslam also wanted to do this, and he knew it was the right thing to do, but he couldn't get it through the legislature. Until there are Republicans who are willing to say, this is the right thing to do for the people of Tennessee, it's never going to happen, because right now we're run by legislators who simply do not believe that poor people couldn't somehow get it done on their own.
And so what does the Tennessee Justice Center do about that?
On Medicaid expansion, all we can do is continue to spread the word, to lobby legislators, to try to convince some of the ones who, many legislators have said, I actually agree with this, but I can't politically do it because it's just not part of the brand. They have to oppose it. So all we can do is keep the pressure up. There is no alternative right now. People are either going to keep dying, hospitals are going to keep closing, or eventually legislators are going to come around and say we need to do this.
Let's go to Ann. Take a couple of calls here. Hello, Ann.
Yes. He's made so many valid points, and it's a matter of whose name is on the plan. Unfortunately, he's absolutely correct. It's been labeled as Obama, and they won't back down no matter who suffers. I'm one of the lucky ones. I had insurance when I retired. I pay roughly $600 a month for my husband and I to do it, to have insurance. And on one medicine, I pay this month $200 for that one medicine. At the beginning of the year, I paid over $400 a month. and I will continue to pay $197.63 through December. It decreases slightly. That is just one of my medicines. Something else that is a misnomer, as I'll call it, is pre-existing conditions. Yes, they will take you if you have a pre-existing condition, but they will not cover that condition. And that's something that people are rejected on time and time and time again. I have a sister who was eligible to get insurance, but those conditions she had when she was accepted were not covered. She was covered from the day she was accepted, but the conditions she had prior to that day were not covered. So yes, she was accepted with her pre-existing conditions. They just didn't pay on it. Our legislators won't back down. They won't face the people beside them. If they do, they're not willing to accept the consequences. And our residents in our rural counties are paying for it. I have a child that walked across our country on back roads. She was 3 different times needed medical assistance, and in 3 other states, without questions being asked, were treated. All 3 times it was in rural settings because she didn't have insurance, and they freely accepted her into those areas and treated her. Had she been in Tennessee, it would not have been done.
Okay.
And it's sad. It's absolutely sad that in the state where HCA has 80% of their headquarters, Vanderbilt, we have so many facilities and so many resources and so many people uninsured.
All right, Ann, thank you. There's a lot to go through there. What about the pre-existing condition part that she's talking about?
Well, so this gets complicated in Tennessee because we're also unique. The Affordable Care Act banned insurance companies from denying policies to people with pre-existing conditions or for limiting their coverage to things not related to that pre-existing condition. So any plan that you buy on the federal marketplace through healthcare.gov or any employer-sponsored plan or anything that constitutes minimum essential coverage is what the legal term for it, has to cover all pre-existing conditions. But in Tennessee, we're leaders in what are called things like, they have different names, association health plans. Most of these are run by the Tennessee Farm Bureau. These are not subject to the Affordable Care Act rules. So lots of people buy them because they think, oh, the premiums are really low here. But in fact, they actually don't cover, they're not subject to the same laws, so they don't cover pre-existing conditions. They don't cover all the health benefits. They may have limited pharmacy, or they may not cover pregnancy, or things that any Affordable Care Act plan would have to cover for everyone. So often people buy these Farm Bureau plans thinking that they're going to be good insurance, and the nature of insurance is you never know the reason we call it insurance is you never know what you're going to need. Something could happen and you suddenly find out, oh, this insurance is not what I thought it was. And all too many of my clients are in that situation where they thought they had insurance and suddenly they realize, oh, this was not an ACA compliant plan, and therefore now I've got a $10,000 hospital bill.
That's fascinating. I did not know that was happening. That's fascinating. All right, we have to take a break. We'll continue to talk about, I guess, what Ann said. I want to talk about the cost of medicines. And I want to encourage others to call in. We're opening up the phones. There's the number, 615-737-PLUS, 615-737-7587. You have a story, a thought about what we're discussing, give us a call. Take a break. Be back right after this.